Good morning, and thank you for joining us. Well, each day, more and more people in our community are getting vaccinated, and each day we're learning more and more about the effectiveness of these COVID-19 vaccines. You have a lot of questions. You've been asking us a lot of questions about the vaccine, so today we wanted to get you some answers. I'm Kayla Thomas, and today I am joined by two of our experts, Dr. Kelly Cawcutt from Infectious Diseases and Critical Care, and Dr. Jasmine Marcelin from Infectious Diseases. Thank you both for joining us today. We have a lot of questions for you.
Thanks for having us.
Thank you.
You bet. And for those of you watching, this is a live chat. It's for informational purposes only. So if you have any questions directly about your health or medical condition, you want to, of course, direct those towards your primary care provider. Okay, well, we saw the vaccinations rolling out just before Christmas time. So millions of vaccinations. Dr. Cawcutt, what have we learned so far about the safety and effectiveness of these vaccines?
So it's a great question. And just as you said, we have seen millions of vaccines used here in the US and frankly, really across the globe. And so far, the vaccines really do seem to be remarkably safe. There are side effects that happen, and I know we'll probably talk on that a little bit more, but those are not permanent impacts or significant health problems. Those are side effects from the immune response to the vaccine and are temporary. As far as severe reactions go, there's been some discussion about cases with anaphylaxis or a severe allergic reaction, and those have thankfully been very rare. In addition, these are being monitored continually, particularly here in the US and with the manufacturers, to really register people with different types of side effects so that we have ongoing data available for us related to what kind of side effects people may be suffering from or what kind of symptoms post-vaccine they may have. But again, despite those kind of temporary symptoms you might have after the vaccine, they do seem to be very safe.
We've seen more people in the community getting ready kind of for those second doses. And obviously a lot of our healthcare workers have been fully vaccinated already. And it seems like we've been hearing a lot about stronger side effects from that second vaccine. And Dr. Marcelin, I know you experienced that yourself. Can you explain why that is?
Yeah, and it's really the immune system that is showing us that it works, that it remembers that we got the first vaccine, that it remembers the point of the vaccination, which was to give our bodies that information to store away so that in the future, when it encounters something that looks like this coronavirus again, that it will be able to rev up really quickly. So with the second dose of many of the vaccines, what we're seeing is people having these immune effects like chills that they may have, body aches, just generally not feeling well. Some people can have fevers. And this can last anywhere between 24 to 48, 72 hours after that dose. The most common effect after getting vaccinated, though, is just soreness and pain at the site of the injection itself. And so most people will experience that. The types of other immune responses that people may have in response to that second vaccine really vary. And, we talk a lot about how this is just, don't worry about it. This is your immune system working and it's showing you that it's working. And that is true. But if a person does not experience those immune side effects or immune symptoms, that doesn't mean that their immune system isn't working. How I like to put it is that there are different degrees of how loud our immune systems are. Some people's immune systems, like mine, are just really loud, obnoxious even. And then others just kind of go along quietly, do their job, and don't make a fuss. And they're doing what they're supposed to do, but they're not going to make a fuss about it. And so if you don't experience some of these obnoxious immune effects, don't worry about whether or not you got a good vaccine or is it working or something wrong with your body. It has nothing to do with that. It's just different degrees of loudness.
See, I appreciate the fact that you said that, because my aunt's in a nursing home. She's 89 and she took it like a champ. She didn't have any issues, but it's good to know that that's nothing to worry about, because I think some people, when you hear the varying responses, along that same line of conversation, we've heard of some people not going back for the second dose, which is alarming. So why is it so important to get that second dose?
Well, so the vaccines were studied. The current vaccines that we have authorized for use were studied to be 2-dose vaccines. We know that after the first dose, there is some recruiting of the immune system. There's some memory that is being built, but it's not enough. And based on the data that we have from these clinical trials, when we're talking about the effectiveness of these vaccines and we're throwing around numbers like, it protects you from serious disease 95%, and so forth, those are with 2 doses of the vaccine. And so we know that the maximum protection that a person can have is really after about 2 weeks after that second dose. So it's really important for people to go back. So one of the things that we can do to try to help mitigate the issue of folks not returning for the second dose is trying to schedule that second dose right at the same time as the first dose. And that's, we've been doing it at our employee vaccination clinics, but that's something that's really important, because if a person has to leave and then try to figure out how to get back, whether or not they're going to be able to make it for that second dose, that can just add an extra layer of complexity to that individuals. And so while they're there, they're motivated obviously to get the vaccine. And so it's just a matter of, let's take a look at our calendars. Let's see when you are able to come back. Let's try to get you back in the next 3-4 weeks. And what does your schedule look like? Let's try to hook that up for you, rather than leave it for another decision down the line. It's really important to get that second dose so that people are fully protected against COVID-19.
So what we've been seeing so far is obviously the Pfizer and the Moderna vaccines, but I think people have probably heard about some of the other ones that are coming down the pipeline, the Johnson & Johnson, for example. Dr. Cawcutt, what does this mean as far as getting more vaccines out there and how fast we can get everybody vaccinated?
So before I answer that, I do want to go back and add one thing to Dr. Marcelin's point, and that is, if you missed your second dose, you didn't get it exactly on week 3, that doesn't mean you should not call and try to be rescheduled for that dose, even if it is a little more delayed. So we do want to encourage the people who might be watching who maybe missed that and fell into that group of people to go ahead and call, because we do still want to try to get that second dose in as soon as possible, even if it's not perfectly in that timeline. And that echoes great into the question you asked. So what is the benefit of some of these other vaccines coming onto the market? So for instance, the Johnson & Johnson vaccine, as a 1-dose vaccine, gets rid of this need for that second dose, which makes it a lot easier to vaccinate larger groups of people, because we don't need to schedule all of those follow-up appointments. It's easier for people to come in and get a single dose at a period of time, and there's less paperwork and scheduling involved with that. There's also differences as these vaccines come out in relation to how they're stored. So like the Pfizer vaccine required this profound deep freeze that made it much more difficult to have it widespread at all the different facilities in the state that we'd like to be able to get at to vaccinate more people. And so just logistically, some of these new vaccines may make getting vaccines out to our community and the greater state, even in more of the rural areas where they may not have those big deep freezers, and to be able to really expand that vaccine process. It's also just a lot more vaccine that comes to market that's available to hopefully mobilize and move forward. And they're all being assessed to make sure they're effective vaccines. So I'm less concerned about having major changes in efficacy and more concerned about getting vaccine out to people where we have not been able to do that effectively so far.
Well, I've got you, Dr. Cawcutt. The different variants that are out there, we're hearing more and more about them, a lot of talk on the news about it, and it's alarming to a lot of people. What do we know about the effectiveness of the vaccines on these new variants that we're seeing?
So that's a question that many of us have had as the variants were described. So there's a couple major variants that are really coming into play in this discussion. The UK variant, which has also been called the Kent variant, the South African variant, and the variant coming out of Brazil. And these three variants do seem to be substantial enough to change some of the epidemiology of the virus, and they've had some structural changes to the virus. And we do see some clinical changes in increased infectivity, meaning it seems to be more contagious than the original virus. But thankfully, so far, the vaccines all seem to have some efficacy against the variants. There was some specific concern about that South African variant being the one that might escape vaccine-related immunity at the highest frequency, but it doesn't mean that the vaccines have no efficacy there. So I think what we're seeing is it still is offering some protection, and it appears in the very, very early data that it probably still protects infection in the most severe illness. So hopefully still saving lives and keeping people out of hospitals, but it doesn't guarantee that you won't get COVID-19 as a milder form of illness. And we may see more data arise that says these vaccines are less efficacious or more efficacious, as many studies are ongoing. But right now, all three major vaccines that are coming to market and available now with Moderna, Pfizer, and the AstraZeneca vaccine at least appear to have some efficacy against all of them.
I think efficacy is like a new vocabulary word for many of us, like social distance, all these other things that we're hearing about. And we'll obviously continue to learn more as we get through this, as we've continued to learn things throughout the pandemic. Vaccine hesitancy is real, and especially when it comes to Black Americans. And I know that's a topic that you're passionate about, Dr. Marcelin. What can be done to convince everyone, and specifically certain communities, that this is safe, and the more of us that get it, the better?
Yeah, thanks for asking that question. So there's a spectrum of concern and hesitancy about vaccines, about the COVID-19 vaccine that affects, across the country, all Americans. People have just varying degrees of concern and questions. And so I think in general, the approach has a lot to do with the way that we talk about vaccines, the way that we are transparent about how they were all developed, and what are the differences between the vaccines, and what are the benefits, and what are the risks, and what are the things that we legitimately don't know about the vaccines yet, and really being upfront and transparent about that, so that everyone really has the opportunity to consider the vaccine, consider the risks and benefits for them, talk to trusted individuals about it. So when we're talking about mistrust in the Black community, this is complex. This is not a situation of the people who are in the Black community just, well, they don't trust anything that comes out of, the medical establishment. The reality is that healthcare and medicine has not proven itself trustworthy. There's 400 years of receipts that have shown that we have not proven ourselves trustworthy to people in the Black community. And there are same sorts of receipts when it comes to Hispanic and Indigenous individuals as well. And so there's the history, but then there's also what's happening contemporaneously, what's happening right now. When we think about the impacts of medical racism and structural racism within the healthcare machine, this is a daily basis that people are experiencing these things. And so they have every right to question and to be concerned, because there has not been enough demonstration on the part of healthcare to show that there is a true concern for these communities. So the right approach, in my opinion, is to really, first of all, understand this connection, understand the role that healthcare organizations and healthcare professionals play in perpetuating structural racism throughout medicine, and acknowledge that. And then in the pledge to do better and be better, part of that has to do with, in the context of COVID-19 and the vaccines, really listening to folks and trying to understand what individual concerns may be. It's very easy to put a blanket concern and say that Black people are mistrustful because of X, and usually the X comes down to something like the Tuskegee syphilis experiment, and then chalk everything up to that. But it's really more complex than that. I've shared multiple times before how I had my own anxieties about getting a vaccine, and that was related to needle anxieties and fears that I had to overcome. If somebody had come to me, if I had shared prior to getting my vaccine that I was anxious and I was nervous, and somebody come to me and say, well, blah, 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 Tuskegee, that would not have resonated with me because that was not my concern. So I think the first thing that we have to do is ask when somebody says, I'm not getting the vaccine, or I don't know how I feel about it. Ask for permission to dig deep into that. May I ask why? And then have a conversation. And before launching into a long explanation about, all the science and all of the other things, really try to dig deep to get the individuals to share what their concerns are, and then try to address the concerns if they would like on a case-by-case basis. It's something that takes time. It's something that takes energy and effort, but it's time and energy and effort that is well spent if the outcome is people that we're talking to who actually understand what it is that we're recommending that they take. And this is something that is not a strategy that specific to the Black community. This is a strategy that I would like to have, throughout the entire community, that we just take the time to ask people questions, learn about what their concerns are, and then address those on an individual basis, and then do the work on the back end when it comes to addressing the issues with vaccination in the Black communities, because it's not just about whether or not people are hesitant, it's about the access. We have data that shows that in some of the southern states, they're rolling out vaccines, and the age groups that they're rolling out vaccines, 75 and older, there's a large percentage of the population the Black population who never make it to that age. So if you're saying that we're going to be doing vaccine rollouts and we're going to be doing them equitably, look, we're going to do it by age, and the Black community, the life expectancy of the Black community doesn't even reach that age, are we really being equitable? We have to go in to our communities and say, okay, are you interested? Do you want the vaccine? And how do we get it to you? Let's connect with our community organizers, our faith-based organizations, all of these folks who are in the community who want to be able to get vaccines to folks. It has to be done in that way, or else we're not going to be successful.
And I think it's important for people to share their experiences. You've been very open about sharing yours with everyone too, so that as much information is out there as possible, people can do their research, ask their questions, and all of us can understand that everybody's coming into this with an individual perspective, individual health questions. And that reminds me that it's been women who are pregnant or breastfeeding also might have concerns about this and not knowing what their situation is, what the best move is there. What are we learning about that situation so far, Dr. Cawcutt?
So that's a fantastic question. It really stems from the fact that pregnant women were not enrolled in the original trials. There's been a long historical avoidance of enrolling pregnant women in medical studies and early studies because of potential risks to the pregnant mother and to the developing fetus and congenital defects that are a concern at the time of birth. So far, we've learned a few things. One is that there were women who became pregnant after they got the vaccines in the trials. And when they have followed those women through, they have not seen congenital defects that have arisen. So meaning there's nothing wrong with the baby when the baby's born. They've not seen increased risk substantially of harm to the mother or other clear adverse events. So amongst those women, which is a smaller cohort for sure, meaning a smaller group, there really seems to be a realm of safety there. And the science does back that up, especially for these mRNA-based vaccines like Moderna and Pfizer, where this mRNA enters the body, but it doesn't integrate with our genes. It is just used to trigger the immune response and then disappears out of the body as it kind of falls apart. And that mRNA does not have the capacity right now, as far as anyone has been able to prove, to get to the developing baby or to cause any issues from that standpoint. So the science behind it is reassuring also that it should be safe for baby. And this is tricky when you think about deciding to do something where there's not as much data. So now women are pregnant and are asking their doctors, should I be vaccinated when there's not as many women who've been studied? And our national societies in the United States for obstetrics, with the physicians caring for our pregnant women and for the physicians taking care of these newborn babies, both groups have recommended vaccination for pregnant women or women who are breastfeeding because they believe the science stands to reason that it is safe. And the women that have been enrolled, again, it appears to be safe. And the pregnant women who have opted to get one of the doses of these millions of vaccines so far appear to be having no adverse events or side effects from that. In addition, we are also being very cautious with monitoring, like we talked about earlier. So pregnant women are being watched closely for any adverse events and reporting those. And finally, frankly, COVID-19 in pregnant women is a concern. Getting the infection carries significant risk to both mom and to developing baby or baby who's newly born, right? In those early phases of infancy, when they don't have an immunity and they don't have a robust immune system yet. So we know there's an association of pregnancy and more severe illness if you get COVID-19. And the fevers and the impact of COVID-19 infection can severely impact mom and baby. So we're weighting these real risks of the infection against limited data, but so far at least reassuring data. So all of this being said, it's really important, as Dr. Marcelin was talking about, with your individual questions and concerns, to really have those individual discussions with your trusted resources, whether that's your primary care doctor, the pediatrician that you see with your family, your OB doctor who is taking care of you during pregnancy, whether you need to reach out and talk to someone else with more infection and vaccine understanding from the infectious diseases community. But really having the opportunity to have those discussions, to talk about your individual risks of COVID-19 versus the potential risks of the vaccine is really important. And then weighing those and making an informed decision on when you would get the vaccine if you do plan to get it.
A question that we have been hearing a lot involves people who are vaccinated and continuing to wear masks. A lot of people are like, well, if I'm vaccinated, why do I still have to wear a mask? So explain a little bit about that, because it's going to take a while to get the vaccine out to the entire community. Dr. Marcelin?
Yeah, it's a really great question, and I saw a tweet this morning by Dr. Kamara Jones, who is a phenomenal scholar in health equity, and she talked about how we get to get rid of the virus in our community. She said COVID-19, the coronavirus that causes COVID-19 requires both an available and a susceptible host in order for it to be able to spread. And what that means is people have to be around and near each other in order for the virus to go from one person to another. That's the availability part. And then people have to have never seen or had any sort of exposure to this virus before, so they don't have any immune memory to the virus, and that's the susceptible part, right? So you need both to be able to eradicate the virus from our community. So on the availability part, what masks do, despite the vaccines, is that because we don't have the vast majority of the community vaccinated yet, we still need folks to be able to wear the mask, because there is a possibility that an individual who may be vaccinated, while they were not going to be sick and die from the virus, they're still, in the community, and we're still gathering the information about how likely is it for an individual who has been vaccinated to still possibly, once they've been exposed to the virus, to still be able to infect someone else. And it's looking like that is going to be less and less the case, but we still need to be careful in terms of how can we stop the spread of the virus from person to person. So yes, if you have been vaccinated and you're going to be encountering folks who have not, and you're going to be in a place where you're with people who are not from your household, the public health measures still stands. We want folks to wear masks. The whole concept of masking to protect myself and to protect you still stands regardless of the vaccine. What the vaccine will do is to help reduce the number of folks who are susceptible, reduce the number of folks who are likely to get very sick and very ill and potentially die from COVID-19. And so we still need folks to be able to take the vaccine, to be able to reduce that risk. And once we get to that tipping point where the virus is no longer able to keep going from person to person because people are not susceptible to it anymore, and people have held on to these public health measures such that it just is impossible for the virus to be transmitted from one person to another, then we will finally be free. But we have to do both. It's really important for us to not feel that false sense of security because we have vaccines, that we are then able to relax on the public health measures that have gotten us to a point where finally we can see some relief, but it's not complete relief, right? And so we need to keep doing both.
And we've made it this far, so we really need to go ahead and see it through. Along that same note, a lot of us, I think, have had older relatives who we've been waiting to see who have gotten vaccinated or almost vaccinated. Dr. Cawcutt, I know you had talked about your parents getting doses. When is it safe to see them, hug them? How can we treat the situation? Because I know some of us are kind of dying for some hugs.
Yeah, so again, it's another really good question, and we've all been waiting a long time, right? We've been waiting to see our families, spend time with them, to hug them, and I really wish it was an easy answer and that I could tell you that that vaccine was your golden ticket, but as Dr. Marcelin has just illustrated, it is not. So close contact with people who live outside of your home still carry risks, as again, that vaccine doesn't guarantee that you're not shedding virus. It keeps you healthier, it decreases the number of people that are susceptible, but the vast majority of people aren't vaccinated yet. And even in the state of Nebraska, we're still in the single digits of percentages of our state's population who've received a dose of the vaccine. And so I think it's really important to think about, one, if you're talking about hugging and seeing family members, you need to realize that we're a year into this and some family members are maybe not going to want to do that. They may be uncomfortable because they aren't vaccinated, they're high risk, and they're worried about protecting themselves, but also maybe protecting their own family. And I definitely know that's a perspective that I have looked at, is how do I protect my own family even though I'm vaccinated? Because not everybody is. And second, thinking about wearing masks still when you're visiting people is important. Yes, the likelihood that you develop severe illness if you've been vaccinated and are exposed to COVID is much lower. But we have to remember, again, with all of the people that aren't vaccinated, including a multitude of adults who have different higher risk conditions, all of the children who cannot be vaccinated by a vaccine on the market yet, it's not just about who you see in a one-on-one setting, it's also about who they go home to. And we've seen so many instances where a small group of people gather for a birthday party, a wedding, like the example on the East Coast, and one person has COVID and people are unmasked, and then it spreads, through multiple degrees of the community to people who weren't at that event because the virus was what people brought home, and it found people who were still susceptible. And at this time, we just don't have the capacity to say it is okay to step away without your mask, to not use that great hand hygiene, because again, we have to consider not just the two people involved or the people getting together without the masks, but the ramifications if one of us is carrying COVID and we don't know.
Finish strong, I think, is what one of the sayings the health state department is using to kind of advocate now. Even though we're seeing these vaccines, we just need to keep doing the things that we know we need to be doing until we can really get this more under control. Kind of one topic that I want to address, and this will be our last question because I know you're both very busy. We've seen the number of cases and especially hospitalizations here in Nebraska drop very drastically over the last few months. Can we celebrate? Can we breathe a sigh of relief? What does this mean? And what do we, obviously we need to keep doing those things, but it's a positive trend.
It is a positive trend, and we are all grateful to see the decrease in cases. We are grateful to see the decrease in hospitalizations because we know that will also translate continually towards a decrease in the number of people who die from this infection. But you need to remember that that decrease does not mean that the virus is controlled in our community. If you look at the number of positive cases still happening in the last week, we are still in the realms of widespread, uncontrolled infection in the community. So we still could absolutely see a surge and a peak happen again if we don't keep our guard up, if we don't keep doing all of these directed health measures of masking and social distancing and hand hygiene, and then advocating again and educating for vaccine use and for people to get the vaccine. So this also is augmented by these variants we were talking about, right? If we have those variants coming into our community, which we are seeing in other areas of the country, if they are indeed more contagious, that does put us at risk for seeing larger outbreaks. And just like we talked about the vaccine not necessarily being perfect at preventing you from being infected from COVID-19, having had COVID-19 a year ago, 6 months ago, may not prevent you from getting it again. So we still have those risks at play. So unfortunately, it's not time to retire our masks or our hand hygiene or some of these distancing things, but is there hope on the horizon? Absolutely, we have hope, but we do still have to continue all of these things until we can achieve a point where these cases have come down profoundly and more of our population is successfully vaccinated.
Thank you both for your time today, not only in taking the time to do the live interviews and of course, not only taking the time that you do with patients on a daily basis, but you're also helping us get information out there through the Nebraska Medicine social media platforms, through our website, nebraskamed.com/vaccine. All of our infectious disease experts are reviewing all this content that we create because we're doing the best that we can to keep you informed. So thank you both for your time today and stay warm, okay?
Thanks for having us. You too.
You bet. Thanks to all of you for watching. Again, if you have questions to submit or you can post those in the comment section below and we'll do our best to get you answers. Also a huge FAQ that we're constantly updating at nebraskamed.com/vaccine. Thank you all and have a good afternoon.